Have you ever wondered if the medications you're taking might be doing more harm than good in the long run? Surprisingly, some medications that many of us use daily are ones doctors try to avoid themselves. Why? Because while these meds can provide temporary relief, they often come with serious risks when used over a long period, especially if they don't address the root cause of your health issues. Instead of focusing on true healing, many medications mask the symptoms, which could lead to even bigger problems down the road. In today's video, we're going to take a closer look at 5 common medications that doctors steer clear of for prolonged use. These might be in your medicine cabinet right now. By understanding the risks and learning about safer, long-term solutions, you can make more informed decisions about your health. Let's dive in and find out which medications you need to watch out for. Number 1. Non-steroidal anti-inflammatory drugs. Let's start with something you've probably taken before: non-steroidal anti-inflammatory drugs. You might not recognize the term, but you've definitely heard of ibuprofen, Voltaren, and diclofenac. These are over-the-counter pain relievers that many of us use for everything from headaches to joint pain. They're effective, easy to get, and offer quick relief. But here's what most people don't realize: while non-steroidal anti-inflammatory drugs can be helpful for short-term pain, their prolonged use comes with some serious risks. Cardiac risk. One of the biggest concerns with long-term non-steroidal anti-inflammatory drugs use is the increased risk of heart failure. Studies have shown that regularly using non-steroidal anti-inflammatory drugs can increase your risk of heart failure by as much as 20%. That's because these drugs can cause your blood pressure to rise and affect the way your heart functions over time. Gastrointestinal issues. Non-steroidal anti-inflammatory drugs don't just stop at your heart. They can also wreak havoc on your digestive system. Prolonged use can lead to ulcers, bleeding, and even perforations in the lining of your stomach and intestines. For someone who uses these drugs regularly, the risk of a serious gastrointestinal issue is much higher. Kidney damage. Then there's the impact on your kidneys. Non-steroidal anti-inflammatory drugs can reduce kidney function, cause fluid retention, and lead to swelling. Over time, this damage can become irreversible, especially for those who already have kidney issues. So, what starts out as an easy solution to pain could lead to long-term kidney problems. Other side effects. Aside from the major risks, non-steroidal anti-inflammatory drugs also come with a laundry list of other side effects. You might experience dizziness, allergic reactions, or headaches. While these may seem minor, they're still a sign that your body might not be responding well to long-term use. Why doctors avoid long-term use? Most doctors know that while non-steroidal anti-inflammatory drugs work well in the short term, the risks far outweigh the benefits if used for too long. That's why they often turn to other pain management strategies that address the underlying cause of pain rather than just masking it. Alternative solutions. So, what can you do if non-steroidal anti-inflammatory drugs aren't the best long-term option? There are plenty of natural ways to manage pain. Low-impact exercises like yoga or swimming, physical therapy, and acupuncture can offer relief without the risks. Lifestyle changes, such as maintaining good posture, staying active, and keeping a healthy weight, can also go a long way in reducing pain without the need for medication. Number 2. Statins, cholesterol-lowering medications. Statins are one of the most well-known and commonly prescribed medications for reducing cholesterol and lowering the risk of heart disease. When they were first introduced, statins were considered a major breakthrough in medicine. By lowering LDL, the bad cholesterol, they help prevent heart attacks and strokes, especially for people who are at high risk. But while they've saved many lives, statins are not without their drawbacks, especially when used long-term. Relative versus absolute risk reduction. one thing to keep in mind is that while statins can reduce the risk of a heart attack, the numbers can be a bit misleading. You'll often hear that statins reduce the relative risk by about 30%, which sounds impressive. But when you look at the absolute risk reduction, the actual difference is only about 1% for most people. So, while they're effective, the impact may not be as big as it seems. Side effects. Statins come with their own set of risks and side effects. One of the most common is muscle damage, which can range from mild pain to more serious conditions. Some people also experience an increased risk of developing type 2 diabetes while on statins, which can be a significant concern for long-term health. Additionally, statins have been linked to cognitive issues, such as memory problems or brain fog, in some individuals. While not everyone will experience these side effects, they're worth considering. Risk of hemorrhagic stroke. There's also a lesser-known risk of hemorrhagic stroke, a type of stroke caused by bleeding in the brain. Though this risk is relatively rare, it's something doctors consider when prescribing statins, particularly for long-term use. Why doctors avoid long-term use? Doctors may be cautious about prescribing statins for long-term use, especially if high cholesterol is the only issue a patient faces. In many cases, they prefer to recommend lifestyle changes instead, focusing on diet, exercise, and stress management, which can have similar effects without the risks. Alternative solutions. So, what's the alternative? A healthy diet rich in vegetables, fruits, whole grains, and healthy fats can naturally lower cholesterol. Regular exercise and weight management are also key in maintaining heart health. And don't forget stress reduction techniques, like meditation or yoga, which can help keep your heart and mind healthy without relying on medication. Number 3. Sleep medications, zolpidem and hypnotics. Sleep medications, like zolpidem, commonly known by the brand name Ambien, are often prescribed to help people who struggle with insomnia. They can seem like a lifesaver when you're tossing and turning all night, giving you the chance to finally get some rest. But as effective as these medications might be in the short term, they come with significant risks when used over a long period. Side effects. One of the biggest concerns with sleep medications is the range of side effects. You might experience drowsiness and dizziness, which can make it difficult to function during the day. For older adults, the risk of falls increases significantly. In some cases, people report abnormal behaviors, like sleepwalking or doing things while half asleep that they wouldn't normally do, which can be dangerous. Dependency. Another major risk is dependency. Over time, your body can become reliant on these medications to fall asleep. This means that when you stop taking them, you could experience something called rebound insomnia, where your sleep problems come back even worse than before. This makes it hard to stop using the medication, trapping you in a cycle of dependency. Impact on sleep quality. While sleep medications help you fall asleep, they don't necessarily improve the quality of your sleep. These drugs can alter your sleep architecture, meaning they change the way your body moves through the different stages of sleep. Specifically, they can reduce the amount of time you spend in deeper, more restorative sleep, leaving you feeling groggy or unrest the next day. Drug interactions. It's also important to be aware of drug interactions. Sleep medications can interact with other drugs you may be taking, alcohol, or even certain foods, which can increase the risk of side effects or make the medication less effective. Why doctors avoid long-term use? Because of the risks of dependency, the impact on sleep quality, and the various side effects. Most doctors avoid prescribing sleep medications for long-term use. They know that while these medications can offer short-term relief, they aren't a sustainable solution for chronic insomnia. Alternative solutions. Instead, doctors often recommend behavioral changes to improve sleep. This includes good sleep hygiene practices, like avoiding electronics before bed and keeping a consistent wake-up time. Relaxation techniques, such as meditation, deep breathing, or reading, can also help calm the mind before sleep. Cognitive behavioral therapy, CBT, for insomnia is another highly effective method for treating sleep problems without medication. Number 4. SGLT2 inhibitors, type 2 diabetes medications. SGLT2 inhibitors are a newer class of medications used to treat type 2 diabetes. They work by helping the kidneys remove excess glucose through urine, which in turn lowers blood sugar levels. While these medications can be effective, especially for people who have trouble managing their blood glucose, they also come with some serious risks, particularly when used long-term. Increased risk of infections. One of the main risks with SGLT2 inhibitors is the higher chance of infections, especially urinary tract infections and genital infections. Because these medications cause the body to flush out excess glucose through urine, it creates an environment where bacteria and yeast can thrive, leading to infections that can be difficult to manage. Dehydration and fatigue. Another issue with SGLT2 inhibitors is that the excessive loss of glucose through urine can also lead to dehydration. When your body loses too much fluid, it can leave you feeling fatigued, lightheaded, and generally run down. This can be especially problematic for people who are already managing other health conditions. Diabetic ketoacidosis. Perhaps one of the most serious risks of using SGLT2 inhibitors is the potential for diabetic ketoacidosis, DKA. DKA is a dangerous condition where the body starts breaking down fat too quickly, producing acids called ketones. This can happen even when blood sugar levels aren't extremely high, which makes it tricky to spot. DKA is a medical emergency that requires immediate treatment. Amputation risk. For people with diabetic neuropathy or peripheral artery disease, there's also an increased risk of amputations. While the exact reason for this isn't entirely clear, studies have shown that patients taking SGLT2 inhibitors may be more likely to require amputations, particularly in the lower limbs. Why doctors avoid long-term use? Because of these significant risks, particularly the possibility of infections, dehydration, DKA, and amputations, many doctors are cautious about relying on SGLT2 inhibitors for long-term diabetes management. They often prefer to explore other treatments first, especially for patients who are not at extremely high risk of complications. Alternative solutions. The good news is that there are safer alternatives. Lifestyle changes, like adopting a healthy diet and getting regular exercise, can make a big difference in managing type 2 diabetes. Weight management is another critical factor. For many, metformin remains a safer first-line treatment before considering SGLT2 inhibitors, as it's generally well-tolerated and comes with fewer risks. Number 5. Proton pump inhibitors, PPIs. Proton pump inhibitors, or PPIs, like omeprazole, are commonly used to treat conditions like acid reflux and stomach ulcers. They work by reducing the amount of acid your stomach produces, which helps relieve symptoms of heartburn and prevents ulcers from forming. While these medications can be incredibly helpful in the short term, long-term use can bring about some unexpected risks that are important to know about. Nutrient deficiency. One of the biggest concerns with prolonged PPI use is nutrient deficiency. When your stomach produces less acid, it can interfere with your body's ability to absorb important nutrients like vitamin B12, magnesium, calcium, and iron. Over time, this can lead to serious health issues like anemia, muscle cramps, and fatigue. Many people don't realize that what seems like a minor deficiency could actually be linked to long-term PPI use. Increased risk of infections. Another significant risk is the increased chance of infections. Stomach acid acts as a natural barrier to harmful bacteria, so when it's reduced, your body becomes more susceptible to infections like pneumonia and Clostridium difficile, C. diff, which can cause severe diarrhea and inflammation in the colon. Bone health, PPIs, can also impact your bone health. Long-term use has been linked to an increased risk of osteoporosis and fractures, especially in the hip, spine, and wrist. The reduced absorption of calcium plays a key role in this, weakening the bones over time and making them more prone to breaking. Drug interactions. Additionally, PPIs can interfere with how other medications are absorbed. If you're taking other prescriptions, such as blood thinners or heart medications, PPIs can reduce their effectiveness or cause other complications. This makes it important to consider how PPIs might be interacting with your other treatments. Why doctors avoid long-term use? Due to these risks, most doctors avoid prescribing PPIs for long-term use unless absolutely necessary. While they can be helpful for managing short-term symptoms, the long-term effects can lead to more serious health problems that outweigh the benefits of staying on the medication indefinitely. Alternative solutions. Instead of relying on PPIs long-term, doctors often recommend lifestyle changes. Improving your diet, losing weight, and avoiding foods that trigger acid reflux can make a big difference. For mild symptoms, H2 receptor antagonists or antacids might be a safer option. And if PPIs are necessary, regular monitoring and careful consideration of the risks are essential. The key takeaway here is that addressing the root causes of health problems is far more important than masking symptoms with long-term medications. While certain drugs can provide temporary relief, their prolonged use often leads to more serious issues that could have been avoided. By focusing on healthier lifestyle choices, seeking proper medical guidance, and exploring safer alternatives, you can often reduce or even eliminate the need for long-term medication. Remember, your health is in your hands, and making small changes today can lead to a better tomorrow. If you found this information helpful, don't forget to subscribe for more health-related content that empowers you to take control of your well-being. And please share this video with others to spread awareness about the risks of long-term medication use and the importance of addressing health issues at their core.